with Dr. Perry Halkitis, Assistant Professor and Interim Chair of the Department of Applied Psychology at New York University. Doctor, thank you so much for coming in. You've been researching this for 5+ years, and your research finds what exactly?
Well, the issue of bug chasing and barebacking, which should sort of go hand in hand, are very complex. What we know so far is that gay and bisexual men throughout the country and throughout the world are engaging in a behavior that they call barebacking. We know that men are familiar with this term. We know that they believe that there is an intention involved with their risk, that their risk is premeditated, and that some of these men, a subset of these men, are intentionally looking to become HIV positive.
How many?
That number is hard to come by. I mean, certainly any HIV negative man who is barebacking, who is taking intentional risk, who is premeditating risk, knows the possibility that he will seroconvert. The question is, how many are actually going about looking for the virus? It's probably a small subset of that particular population.
Question for you is, we've known about this for a very long time, we've been discussing this before. Why now? Why are we seeing so much attention towards this subject matter at this point in time?
I think there's a lot of reasons. Between 1999 and 2001, we've seen a spike in HIV seroconversions in gay and bisexual men. In fact, a 14% increase. The numbers have remained stable during the 90s, so that's one cause for alarm. The second thing is that the media has finally caught on to this behavior. For a long time, this was an underground behavior. Gay men were participating in it. The media wasn't aware of it. I think the Rolling Stone story is one of the events that happened, which brought attention to this matter, and that was a good thing.
Seattle just came out with new figures for 2002. They're estimating a 40% jump last year and another 60% jump this year in new infections among gay men. You said 14% across the country. We're seeing those are alarming rates. Some people are saying these are the highest rates researchers have seen since the beginning of the epidemic. Are we attributing this mostly to barebacking?
We're seeing a second wave of HIV is what's happening. You know, we had a huge wave in the early 80s, and here we are 20 years later when you think that there would be no new infections. It's happening again. I think there's so many matters here. I think that people are tired of HIV. People are tired of condoms. Prevention efforts are not sophisticated anymore. Put a condom on every time is not a good message. And the other thing that we have to remember is that people are not just having sex. Many gay men are having sex using drugs, interacting with other men who are doing the same things. So the synergy of those behaviors creates great risk.
So then what could be done to address this problem, do you think?
Well, I think first of all we have to understand what bug chasing and barebacking means. I think if you were to poll 10 gay men on the street, they give you 10 different answers. And in fact, a study that I'm doing right now shows that there's no common understanding about what barebacking is. We say it's intentional unsafe sex. When does the intention kick in? 5 minutes before, 5 hours before, 5 days before. So one thing you have to do is understand what it is. And then you have to understand how men develop along these paths to become barebackers or bug chasers. Once you understand that, you can create educational, psychoeducational, because education in and of itself is not enough, efforts, campaigns, and counseling to address the issue.